Hey everyone, welcome to an introduction to data management for community health workers. My name is Nikki Weiss and my colleague is Johan Malcolm. He'll also be presenting with me today. We're both employees of the Office of Health Equity within the Kentucky Department for Public Health, which is in turn within the Kentucky Cabinet for Health and Family Services. This training was designed specifically for community health workers, or CHWs, funded through the Kentucky Department for Public Health's Office of Health Equity. After completing this training, CHWs will be able to securely store physical and digital data, de-identify data to keep sensitive information secure, and navigate REDCap, the platform they will use for documenting visits with patients. In today's course, we'll introduce REDCap. We'll also cover the best practices for storage of physical and digital data. And lastly, we'll discuss how to de-identify data. First, we will introduce REDCap. REDCap stands for Research Electronic Data Capture. It is a system to capture and store data that's used by many public health organizations. As a community health worker, you will use REDCap for charting on your clients, also known as patients. Forms in REDCap that you will need to use include CHW Initial Encounter Form, Patient and Community Health Worker Roles Agreement Form, CHW Partnerships Form, and the CHW Follow-up Form. To use REDCap, you'll be given a link to each form. You do not need a REDCap account to access this link. Each time you need to fill out a form, you will use this link. These forms are set up like online surveys. Once a form is submitted, you will receive a PDF copy of the client's responses. You'll need to save and securely store this PDF for future reference. You can do this by saving a digital copy on a password-protected computer or printing out a physical copy and storing it in a locked filing cabinet that is only accessible by certain individuals. Next, we'll go over a couple examples of screenshots from REDCap. This is the initial encounter form. You'll have to fill out information like the client name, your agency's name, the date of the encounter, the start time, and the amount of minutes it took you to prepare for that meeting. Here's another screenshot of the initial encounter form. You'll also have to fill out information such as patient personal information, as well as contact information.
Thank you, Nikki, for discussing the REDCap forms. So now we're going to talk about storing physical and digital data. Physical data must be kept in locked cabinets, must be stored out of sight from unauthorized individuals. If authorized, must provide physical access control to records via keys, PIN pads, ID swaps, etc. For digital data, it must be transmitted and protected from unauthorized and malicious access within the cloud. It must be encrypted, end-to-end encryption, even during transit in the cloud. End-to-end encryption is a process of secure communication that prevents third parties from accessing data while it's transferred from one end system or device to another. And digital data, it must be backed up periodically in case of loss or deletion, which means you must have either both copies, physical and digital data, just in case if any information is deleted so that you can go back and redo your process. Now we're going to discuss how to de-identify data. Step 1, we're going to review and remove direct identifiers. Direct identifiers are names, addresses, phone numbers, government IDs, treatment provider locations, etc. In this example, we see that there is information for Stacy Myers-Stowe, which gives her whole breakdown, her patient ID, age, birthday address, husband's name, and clinic name. In this case, we're going to remove those text variables and replace them with codes or categories, or truncated them with either ranges or different values. So in this example, we see that her name is changed to patient 2332, which is encoded just for her. We also see that her age is also in range. Now, in this example, we see that her age is higher than the range. But in this sense, if we were going to use the range for her, her range would be 35 to 40. Her address is also changed to a particular region. Her husband's name is being removed and is being replaced with married, as well as the clinic name is being replaced to a different variable, which is designated for the hospital. In step 2, we also remove and recode specific dates. So for this example, for the antenatal card, that information is being removed, as well as the report date is also being removed. We're going to replace those with a particular code, as well from example number 1, from step number 1. We're going to replace that with a different coding, as well as replacing the date. As well as in this example and step, we're going to replace other information, such as specific dates in terms of the different things. For example, like previous pregnancies. It shows that there are different dates in terms of when she was pregnant and in terms of when she conceived. So instead of displaying those information, we're going to replace the year and only keep the month. We're going to remove the year, the end dates of the year, and keep them at the 19, or just remove them completely. Then also, we're going to remove the health during pregnancy information and replace those with coding. Coding types in that essence, which also varies and display different health situations, different health types during those periods of when she was pregnant. As well, we're also going to remove information within the labs that she takes. So, for example, the lab request date was October 2006. Instead of having that, we're going to replace that and remove the entire date and put the 24th week, or the 24th week. Now, also in the date results, instead of the actual date itself and the year, we're going to replace that with 11/13, which signifies that that is the date. November 13th is the date of when she took the results, but never display the year. As well as for the site, we're going to display just the coding of that site, which means that that code signifies to what site she is getting tests from. And we're going to remove the doctor's name and replace it with another code as well as putting date range for the drug intervention date that she's given. Now, step 3, it's very simple. We're going to remove and recode geographic variables. Now with this can be a little bit tricky as to determining which address and zip code and census tract you can change to. Now it determines and depends on the region that you would like to suggest for the particular address and zip code. This is the example that we're going to show here. So for example, the main address is 1234 Main Street, and we're going to change that to a state or broad population region. In this case, we're changing it to region 3. In the next example, we're changing the address, the patient ID, as well as the zip code, and changing those to particular regions so that it signifies who and where this region is designated to. For example, Stacy Myers Doe has a patient ID of 123456789 She lives on 1234 Main Street, City of Nowhere, and the zip code is 21207. Instead, we're going to replace her patient ID, give her a designated number, as well as a designated number for the address and for the zip code. We're only going to reduce it to the first 3 digits. And then we're going to place it into a diagram where it shows that the first row, 2253, is her ID, the 21239 is the address, and the 212 is the zip code. And in this case, there are other numbers that signifies different people and is designated to those people. In step 4, we're also going to remove and recode variables that may link to external data sets. Now in this case, some variables and stuff or data can be linked to external data sources that are potentially public or accessible. Sometimes variables or values can be masked or randomized rather than removed. So in this sense, we have 2 different data sets. One is from a database and another is from our information. In this case, the 2 variables that are highly connected to each other are the revenue and the location. Now, the revenue and the location are designated to each other because it is corresponding with the case number, the outpatient case number. What we're going to do is we're going to remove both the locations as well as the case number, since that case number signifies the patient. We're going to remove the information as well as the location so that there's no connection to either our data as well as the database, so that they cannot be re-identified to the person. And in step 5, we're going to resort and renumber records and IDs. Cases or IDs that may have come from source data, such as medical records, could potentially facilitate being relinked to the source data if shared. When sharing data sets, create new randomized IDs for patients or other case variables. This can be done by calculations in databases or manually in spreadsheets. For example, to randomize subject IDs in Excel, number 1, we're going to insert a column, enter equal rand, open and close parentheses, in first row, or copy down to other cells for random numbers. And as you can see on the right, it shows random 1, subject 1, and then subject ID clean number. So what that means is we're going to try to randomly pick numbers that are identifying to that subject, but in a clean way where it does not designate or give much information about the person. Number 2, we go to sort rows by random numbers, number column. So then again, same thing. And it's going to sort it in a way where it corresponds it in a cleaner format. Then create new sequential numbered variables in a new column for sharing. So in essence, all of these information within the sub ID clean will be placed in a variable where we can actually send that information to other people within that are looking at the data sets, as well as outside if we're exchanging information. That information will be used as a way to keep things clean and not give information, especially in exchanging of data.
Thank you for completing the Introduction to Data Management course, offered by the Office of Health Equity within the Kentucky Department for Public Health. If you have any questions about this course, you can contact either Johan Malcolm or myself, Dr. Nikki Weiss, at the email addresses listed on the slide and in the transcription.